Good afternoon, and welcome to Sharon's Home Healthcare Solutions. Today, I wanted to take a few minutes of your time just to talk about infection control practices and how we can apply that to the world that we're living in. Also, to talk about personal protective equipment, what it is, but especially I want to look at the wearing, the donning, and the doffing of surgical mask or simply face mask. So let's get started. Today we're going to define what personal protective equipment is, not that we don't know what it is as nurses, but I want just for the general population to understand what personal protective equipment, PPE, stands for, and what by definition it means. I also want to look at the Journal of American Medical Association back in March of this year, an article that they put out about personal protective equipment and specifically the wearing of masks. So by definition, from the Health and Safety Executive.gov, by definition, PPE, or personal protective equipment, is designed to protect the wearer from injury or infection. And so the American Journal of Medicine has put out an article about PPE, specifically about the wearing of masks. So this is a big issue of the day, but for nurses such as myself, we have been teaching infection control. I have been teaching infection control for years. And so some of the things that I'm hearing now is totally contradictory to what I have been teaching all these years about infection control. And I haven't just been teaching it to our patients and their families and to other clinicians. So it's very important for me as a registered nurse to ensure that I'm teaching accurately. But what we are hearing today about the wearing of masks from the media, from social media, from the news, is not what the American Medical Journal Association is saying, as are several other medical organizations. So I want to delve into that a little bit today. So by definition, again, it is designed to protect, PPE is designed to protect the wearer from injury or infection. So this is an exact quote. I'm going to be referencing the Journal of American Medical Association from March 4th, 2020, and doing some referencing and also some quoting. So here is a specific quote from that article. Face mask should be used only by individuals who have symptoms of respiratory infection, such as coughing, sneezing, or in some cases, fever. Face masks should also be worn by healthcare workers, by individuals who are taking care of or are in close contact with people who have respiratory infections or otherwise as directed by a doctor. Face masks should not be worn by healthy individuals to protect themselves from acquiring respiratory infection because there is no evidence to suggest that face masks worn by healthy individuals are effective in preventing people from becoming ill. Okay, so if we, that's totally contradictory of what we've been told in the media from the American Medical Association March of this past spring. But if we are going to wear a face mask, or if we are required to wear a face mask, when social distancing is not possible, there are specific guidelines to follow so that we do not spread the germs to others that are on our hands. So when we place them correctly, we don the surgical mask or whatever kind of face mask you're using, and we doff it, we take it off. There's particular ways to do that. So let's get into that. This is again, from the American Journal of Medicine from March of this past year. If wearing a face mask is indicated, it is important to wash your hands with soap and water for at least 20 seconds prior to putting on a face mask. An alcohol-based sanitizer that contains at least 60% alcohol can also be used if soap and water are unavailable. After cleaning your hands, place the face mask over your nose and mouth. Make sure there are no gaps between the face mask and your face, and ensure a tight seal. Try to avoid touching the face mask when wearing it. If you do touch the face mask, what are you supposed to do? Wash your hands again or use a hand sanitizer. When you are done using the face mask, remove it without touching the front of the face mask and discard it into the trash, a closed bin. Wash your hands again after discarding the face mask. So that kind of does away with the current fashion trend to place your face mask on your rear view mirror of your car as you go down the street before you get to the next building that requires the use of a face mask. It might sound that I'm a little perturbed about this issue, which I am, because I'm a registered nurse, and infection control for me is like common sense. But I'm not seeing common sense with the wearing of face masks. I'm seeing the wearer touch the mask several times, lifting it up and over the nose or down and under the nose, or hanging it on their ear, or wadding it up and putting it in their purse or whatever. And the germs then are all over your hands. And I do not see people washing their hands frequently or using a hand sanitizer every time they touch their face. We could be actually increasing the likelihood of a virus or infectious agent because of the transmission of our hands. We have totally lost common sense regarding this issue. So one more thing before I close today, because I wanted to touch a little bit more about the prevention of infection by hand hygiene. Again, I'm reading from the American Medical Association, the Journal of the American Medical Association from March of 2020. And it says this: hand hygiene is one of the most important ways to prevent acquiring and spreading respiratory infections. Wash your hands often. Try not to touch your nose, your eyes, your mouth prior to washing your hands. Avoid close contact with others who are sick. Clean household surfaces and objects with wipes or cleaning spray when available. And if you become ill, stay home to avoid making other people sick. Common sense, guys. Thanks for tuning in to Sharon's Home Care Solutions. I hope you have a blessed day. Bye-bye for now.